So now we are starting with a new chapter, that is immunization. It is a very important chapter for CFM point of view. You will study this in your pediatrics also, but let's study in detail here. So first thing is why you want to study immunization, because immunization is very important for a country, as 30% of Indian population has 30% of Indian population are less than 15 year, and 14% of Indian population is less than 6 year. So we are targeting in immunization this population which is less than 16 years, and we will provide immunization against different vaccines. So now we have a mission Indradhanush. Let me write. Now we have mission Indradhanush. And Indradhanush, like Indradhanush says rainbow. Rainbow means 7 colors. So this is we provide vaccination against 7 vaccine preventable diseases. These 7 diseases are DPT, measles, TB, polio, and Hep B. So these three, 4, 5, 6, 7. Okay. Actually, first only these three were there, then polio added, and then Hep B added. So there are 7 vaccine preventable diseases, and now I will show you the NIS, that is National Immunization Schedule. This is the NIS. So it is you should learn it by heart, because it will be asked, and it is clinically important also. So at birth we give Hep B. At birth we give Hep B. Hep B. Oh, sorry. We have Hep B, OPV0, BCG, and 6-week OPV1, pentavalent 1, rotavirus 1, FIP1, fractionated IPV, and PCV1. Then OPV second dose, pentavalent second dose, rotavirus vaccine second dose. But learn this, that IPV and PCV are not given in 10 week, and then on 14th week OPV3, PV3, rotavirus 3, FIVV2, PCV2. Then on 9 month, very important MR, very important vitamin A, Japanese encephalitis in endemic areas, FIPV3, PCV3. In 16 to 24 months, MR2, vitamin A, JE2, very important, OPV booster, DPT booster, and 5 to 6 year DPT booster, and 10 to 16 year TD vaccine. Okay, so this is very important for you to learn this, as this will be asked in everywhere in your exams. Now we will also write immunization schedule for pregnant females. For pregnant pregnant females, we have TD1, TD2. TD1 should be taken early in pregnancy, and early means it is given at the first antenatal visit. We have learned that how many antenatal visits are there. Antenatal visits are recommended. Actually, there are 4 antenatal visits recommended, but ideal is 12 to 15 in India, and TD2 is after 4 weeks. And there is something TD3, like a mother has taken TD1 and TD2, and within 3 years she is again pregnant. Then we will give a booster that is known as TD3. So it will act as given when last pregnancy less than 3 years, and 2 TD doses. Okay. Then we come to diseases. Then we come to live vaccines. What are the name of the live vaccines? Live vaccines are BCG, MR, the measles, rubella, and polio vaccine, that is OPV, rotavirus. Now you have to also learn maximum age of vaccines till which they can be given. So maximum age means till this age you can give that particular vaccine. So we have BCG. First write me the vaccine name: BCG, OPV, MR, and then JE, DPT, and wait, DPT, JE, pentavalent rotavirus vaccine, FIPV, and IPV, IPV. No, sorry, PCV. So BCG is for 1 year, OPV is for 5 year, MR is for 5 year, DPT is for 7 year, Japanese encephalitis is for 15 year, pentavalent these are for 1 year. Okay. If OPV 0 hours, then it is 15 days. Okay, we will talk about it here. OPV 0. Okay. Now let me talk about this in some detail. That OPV 0 and Hep B birth dose. So you are saying OPV 0 and Hep B birth dose. Why are you not saying Hep B 0? Or why are you not saying OPV birth dose? Because OPV 0 means 0. Whenever we add a 0 after as a suffix in the vaccine, then it means it is an added dose, added slash luxury dose. Means if you give it, then okay. If you don't give, then okay. Let's continue the other vaccine. Like if a child has received OPV 0, OPV 0, then it's very good. If child doesn't repeat OPV 0, then you need not to give it. But ensure that you give OPV 1, OPV 2, OPV 3. Okay. But in Hep B birth dose, it is compulsory to give. Compulsory to give. It's not an added or luxury dose. Sorry. And what is the function of Hep B vaccine? Hep B vaccine inhibit the MTCT, mother to child transmission, and it doesn't have lifelong immunity. It provides immunity. It only provides transmission. Okay. And one thing you should remember, that gap between live vaccine should be 4 week. Okay, 2 live vaccine gap should be 4 week. And now we should talk about, I think, each vaccine. Now we will talk about BCG. In BCG, some points are there which are important. That is, it is live vaccine. We have told it is given 0.1 ml intradermal. Site is left upper arm. Side effect is lymphadenitis and scar. If scar not formed, then don't repeat the dose. Okay. And direct BCG given in India. What is indirect BCG? Indirect BCG means we first test for the tuberculin sensitive test and then give the BCG. And if child is less than 1 month age, then 0.05 ml can be given, and it is given till 1 year. And I think this much is sufficient. No, one more point. It is heat sensitive. Heat sensitive vaccine. Most heat sensitive vaccine is that is reconstituted BCG. Okay, now we talk about OPV. OPV. OPV, we will say it is live live vaccine, रूट ऑफ एडमिनिस्ट्रेशन ओरल, 2 बूंद ज़िंदगी की, 2 ड्रॉप्स देते हैं हम. एंड कब तक देते हैं? 5 years तक देते हैं. और इसमें OPV 0, OPV 1, 2, 3 ये देते हैं. तो आपको पता ही है इसका साइड इफेक्ट क्या होता है. वैप, वैक्सीन एसोसिएटेड पैरालिटिक पोलियो. फिर नेक्स्ट है आपकी Hep B. इट इज़ अ recombinant conjugate vaccine. So side effects will be very less, and it is given 0.5 ml IM left anterolateral thigh. Okay, maximum vaccine. Let me write all vaccine, all IM given in left anterolateral thigh except PCV given in right anterolateral thigh. Okay, only one subcutaneous vaccine, that is MR, and its dose is 0.5 ml. All IM dose 0.5 ml. All intradermal dose 0.1 ml. Okay, this is important. I think you should learn it. It will take your work very easy. Okay. Then we should talk about pentavalent vaccine. Let me first write the components of the pentavalent vaccine. The components of pentavalent vaccine are TPT, Hep B, Immunophilus influenza B, that is bacteria, not virus. Bacteria के क्या है? That it causes meningitis and pneumonia. Meningitis and pneumonia in children, and in this D and T are toxoid. P is killed, and these two are recombinant. So the formula is T2R2K1. 2 toxide, 2 recombinant, and 1 killed. Now in pertussis component, it's very important that pertussis component has 2 types: acellular pertussis, whole cell pertussis. Actually, whole cell pertussis has very severe side effect, that is unconsolable cry, neurological deficits. So baby will cry for more than 3 hours. He continues to cry because he is having neurological pain or neurological deficit, and so is contraindicated in patient or patient with developmental delay or neurological dysfunction. Acellular pertussis is very costly, so we generally prefer this if parents can afford. But in government scheme we do this. Now pentavalent vaccine we give IM, so 0.5 ml dose, where IM most time is given in left anterolateral thigh, and it is given till 1 year. And I have talked about the side effects. Then we will talk about FIPV3. No, sorry, FIPV. Now there is a very peculiar thing about FIPV 1, 2, and 3, which you should remember, that 1 and 2 are given left and given on right upper arm, but FIV3 is your left upper arm. What's the reason? The reason is FIPV3 is given at 9 months, and at 9 months, MR is introduced, measles is introduced, and measles is a right upper arm. So we cannot introduce measles with this vaccine. So we use another location. We cannot take any panga with measles because measles is a disease which have 80% of secondary attack rate, but 90% is preventable. So preventable by vaccine. So it is very important to vaccinate for measles. Okay, so FIPV1 is given intradermal, so 0.1 ml we will give, and location I have told to you, and it is also given till 1 year. You know now rotavirus vaccine. Rotavirus vaccine is given orally, 5 drops. You know OPV, that is oral polio vaccine, is given 2 drop, 2 बूंद जिंदगी की. ये टिल 1 year देते हैं. इसका साइड इफेक्ट क्या होता है? इंटू ससेप्शन. इंटू ससेप्शन मीन्स, should explain like this is one bowel loop, this is another bowel loop. So this bowel loop goes inside the lumen of the other bowel and forms like this. This is known as intussusception. So it is contraindicated in previous abdominal surgery या high risk patient for intussusception. And इसमें we need to know one more thing, that there are 3 types: rotavec, rotatec, rotafix. Okay, so in rotavec, this is the vaccine. So earlier VVM, vaccine wire monitor, was on the cap. Now VVM is shifted on the body. VVM. What the cap, we will use the vaccine and remove it, so it doesn't follow open wire policy. But now it is following open wire policy, and it can be used till 28 days. Earlier it can be used till 6 to 10 hours. Okay, 4 to 6 hours, sorry. Then we will go for PCV. PCB, I think you have done. It is not so hard, I have told you. But PCB, only vaccine which is given on the right anterolateral thigh. IM, so 0.5 ml, 1 till 1 year, no side effect. MR vaccine. MR vaccine. MR vaccine given till 5 year. Subcutaneous 0.5 ml. साइड इफेक्ट जो है, मीजल्स लाइक रैश on 5th day. If measles like rash is occurring earlier than 5th day, it signifies that the baby was in incubation period when for the measles, when he came for the vaccination. Okay, and it is normal. It is completely normal. Okay, now JE vaccine, you know about it, and DPT vaccine, you know about it. Now TD vaccine, I should talk about TD vaccine, T series vaccine. There is DPT, there is TDAP, there is DTAP, there is TD, there is T small d. So what does these all mean? DPT, first remember capital D, small d. Capital mean D, these are the doses of diphtheria. So capital D means D is larger, so higher dose. Larger dose given to small people, that is given to children. Small d means lower dose given to big people. Big people means adults. So this is children dose, this is adult dose. Okay, so this is adult, children, child, diphtheria, pertussis. If pertussis nothing is written, that is whole cell pertussis. If AP is written, that is acellular pertussis. So this is whole cell pertussis. This is acellular pertussis. This is adult dose. This is acellular pertussis. This is child dose. No pertussis here. Child dose. This is adult dose. Okay, very easy. And side effect of TD vaccine is brachial neuritis, because now the baby is more than 10 years. Baby is more than 10 years, so we can use deltoid as a as a site of injection. And when deltoid is used, deltoid has brachial plexus which can be inflamed and lead to this. Okay, then we will talk about unimmunized child. Unimmunized child which is not immunized. So first we should know the gap between vaccines. We know gap between live vaccine is 4 weeks. So what are the live vaccine? Live vaccine are BCG, OPV, rotavirus and MR. So in gap in these will be 4 weeks. Now also remember gap in DPT is also 4 week. Okay, and also remember gap in PCV is 8 week. DPT booster gap is 6 month, or OPV booster gap is 12 month. Actually D comes first, so 6 month. OPV comes late, then 12 month. And OPV 1 booster, like you can remember that OPV have one booster because we have given OPV 0 there, and there is no DPT 0, so DPT has 2 booster, so it is very easy. Now we should give more messages to the parents, like vaccine is given for which disease, and follow a plan when they should come, and minor side effect which should be expected. And we should also tell the major side effect. If anything happens, then they should immediately report to the hospital for further checkups, and they should be told to keep their MCP card with them and regularly update them as per the instructions. And also now there is Kilkari app for immunization, like it remind people about the immunization. And one important thing is, if a child is immunized, like if a child is immunized for particular vaccine and he forgot to take other vaccine, and he also doesn't remember the date on which he has taken the vaccine, then you need not to resume the vaccine, because memory T cells will be present in the body, so you don't restart the vaccine. Just resume the vaccine, give the second dose. Now we will see some question, one two question, and then we will move to another topic. We will see question of unimmunized child. So unimmunized child question is, what vaccine you will give to a 2 week old infant, who has not been vaccinated. Okay, 2 week old. So now infant is 2 week. So the vaccine should, all vaccine should be given of birth dose. Like this should be given ideally, but they are not given in this case. So what are the vaccine that should ideally should have been given? BCG and Hep B birth dose and OPV 0. You know till how much time BCG can be given? 1 year. I forgot to tell, Hep B can be given till 24 hours. Okay, OPV 0 can be given till 15 days. So which vaccine can we give? Can we give this? Can we give this? No. Can we give this? This. Very easy. Similarly, we have another question, like unimmunized child of 2 year age. 2 year age unimmunized child. So we will give 2 year means 24 months. Okay. So ideally, what vaccine should have been given to the child? BCG, OPV, pentavalent, rotavirus, FIPV, PCV. Okay, MR, JE, vitamin A. Are you with me? Okay. This vaccine should have been given to the child, but You know their limits. BCG 1 year till 1 year, so cannot be given. OPV till 5 years, so can be started. Pentavalent RVV FIPV FEA till 1 year, so cannot be given. MR till 5 year can be given. J till 15 year can be given. Immunity till 5 year can be given. So we will give OPV 1, we will give MR 1, we will give one vaccine I have left, DPT. So DPT 1 because DPT booster will not say na, because it is first dose, so we will say DPT 1, and DPT 1 can be given in 4 years, so it can also be given. Or these vaccine will be given. And now we will go to partially immunized child. It's somewhat tricky, but I will simplify. Partially immunized child. So in partially immunized child, the concept is, first thing you need to remember that PCV, here is PCV, rotavirus, FIPV, and PCV are all like a bundle. So if they are started, they should be every vaccine is started, it should be resumed. And if you are starting the vaccine, then you should see that it should follow the NIH. Like let me tell you, like let me take a question for you. 6-month-old child, 6-month-old child who has received BCG OPV1 pentavalent 1. Okay, so it's a 4-year child with who has received BCG OPV1 pentavalent 1. So now we have to say what vaccine can be resumed. So do we give BCG 2 type thing? No, there is nothing. Can we, like I have said, what vaccine we have started, we have to resume. So can we give OPV2 to this child? Yes, it should be given, because the child is less than 5 year old. We should not see less than 5 year, because if OPV started, then it has to be resumed. And pentavalent 1 started, so we should give pentavalent 2. Okay, up now you will say, sir, that 6 months ideally he should have been given rotavirus 1 and FIPV 1, PCV 1. Okay, but in this case he is not given. Okay, so we will not start these vaccine. Why we will not start? Because it will cause chaos. Because understand this, we are not the people who give NIS to the people, to the children, are not so much educated like us. They are not they only know the schedule, and they will work according to the schedule. And now you start with this, and then they have to calculate all for each dose, how much time, how much we gap. So it will be very complicated, so better not to start. It will make bhasad. So you should not start. बट इफ़ यू हैव स्टार्टेड देन यू शुड रिज्यूम. इफ़ आपने अगर भसड़ मचा दी तो आप भसड़ मचाते रहो. भसड़ पहले तो मचानी नहीं है, अगर मचा दी तो यू शुड कंटिन्यू विद द भसड़. ओके, नाउ लेट मी टेक वन अनदर क्वेश्चन फॉर यू. देयर इज 8-month child who has received BCG, who has received OPV1, who has received Penta 1. Okay, so what all vaccines should be given? Same, OPV2 or pentavalent 2. This rota वगैरह not started. Okay, are you understanding now? Same concept. Now take another question. It will also build your concept. 9-month child who has taken BCG. एक second. 9-month child who has taken BCG, who has taken OPV2, Rota, Virus 1, Penta 2, FIPV 1, PCV 1. So we will continue with OPV 3, we will continue with Rotavirus 2, we will continue with Pentavalent 3, continue with FIPV 2, PCV 2. Now we know with pentavalent 1 there is FIPV1. With pentavalent 2 there is no FIPV. With pentavalent 3 there is FIPV2. So it is good, like rota 1, it is penta code, but rota is not good. But we have started, we have basad mach gayi to ab basad machani padegi. So this is the whole concept. And if a child spits the vaccine, then if a child spits the oral dose, then repeat the dose. If he vomits repeatedly, then refer it to the center. Now we like I am reciting the important points. Like always in the visit, we should first give oral vaccine, then we should give intradermal, then we should give IM. Like oral is less pain, no pain. ID is less pain. IM is very much pain. Okay, shake test, important. Shake test is done for free sensitive vaccine. Shake test is done for free sensitive vaccine. Free sensitive vaccine are DPT, Hep B, and like in shake test, we shake the vial, and after shaking, we left for some time, and after left, yeah, we will get clear fluid, or we will get turbid fluid, cloudy fluid. Sorry. And if clear fluid is there, then discard the vaccine. If cloudy fluid is there, vaccine is okay. You can use it. Okay. Now, one important thing is there is campaign for measles, MR vaccine, and polio vaccine. So, if somebody asks you, if I have taken MR vaccine today in the hospital and tomorrow is MR campaign, so can I take MR vaccine? Absolutely no, because these are two live vaccine and 4 week gap should be maintained. And vice versa, if I have taken today MR vaccine in the camp, can I take tomorrow MR vaccine in the hospital? No, the dose taken in the camp will be counted as MR 0, and the MR will be continued as MR according to the hospital. It will not be counted. Okay, but time gap should be 4 week, because we have studied that all live vaccine, the time gap should be 4 week, and live vaccine should have 4 week. But also we have studied that DPT DPT should also have 4 week, and PCV should have 8 weeks, like twice of 4 weeks. Okay, but if same question asks for polio, like if I have taken polio vaccine today and tomorrow is my date for polio in hospital, can I take? Yes, you can take. There is no consideration of gap between the polio vaccine as compared to the gap we see in the MR vaccine. Both are live vaccine, but this is important. Okay. So now let me move to the other part. There is one question also asked, like why site specified for each vaccine. The simple answer is for operational purposes. Like it is very easy to find the adverse effects. We know from which vaccine the adverse effect has occurred, so we can treat them easily, and it is very easy for follow up. And very important, like we have studied, there are more than one or two vaccines given at the same site. So this is important, that if two vaccines are given at the same site, then 1.2 centimeter gap should be there between them. Okay, 1.2 gap should be there between them. Now, vaccine in HIV positive child. Vaccine in HIV positive child. It is important. It is important. Vaccine in HIV positive child. Okay. So HIV positive child, all due vaccine should be given. If all live vaccine contraindicated if CD4 count less than 200, relative CD4 percentage less than 15%, or HIV symptomatic stage 3, stage 4, and OPV contraindicated in sibling of immunocompromised child as risk of VAP. contact web. I will explain. Okay. So let me end this video here. I will explain in the